I'll be honest, I have never experienced pain like trigeminal neuralgia. It's beyond imagining. And yet, even with this terrible experience, I've learned that there are amazing people that are there that can help. Along the way, I've heard the name John Lee.
Hello, this is Dr. John Y.K. Lee. I'm a professor of neurosurgery at the University of Pennsylvania. However, the information and the story that I'm telling today is not sponsored or supported by the university. This is my story, my patient's story, and I hope you can learn from it. So Father Corrigan, 10 years earlier, gets struck by a horrible pain. He thinks it's his teeth. He sees a dentist. Ultimately, he's diagnosed with trigeminal neuralgia. For those of you who are not familiar with this, trigeminal neuralgia is a severe facial pain disorder. The source of it is not always clear, and so patients try usually seizure drugs. Now, this is a crazy thing. This is a nerve pain, and for this nerve pain, seizure drugs work the best. The classic is Tegretol, so he started on this old drug, carbamazepine, but then ultimately he requires additional drugs, Lyrica, gabapentin, oxcarbazepine. And when these medications start to fail or don't work as well, he then gets injections, and ultimately he's referred to me for the best procedure. This is the time-honored procedure, the Janetta procedure, or the microvascular decompression. Now, several years ago, I think this is like 13 or almost 15 years ago, I made a video that you can link to up here. This is one of Penn's most watched videos. It's over 150,000 views, and I narrated the entire surgery. I'm going to narrate part of Father Corrigan's surgery now as well, but this video up here is actually an excellent illustration of the type of surgery that I've done for many decades for this pain. Now, I trained at the University of Pittsburgh, which is where Dr. Janetta was the chairman, and he taught many of us to do this operation. But I've tried to take it to another level where I use the endoscope. I try to do it more minimally invasive for patients who are in pain. This does seem to decrease the number of headaches in a publication that I published many years ago. So with that said, using these minimally invasive techniques, I'm able to get in there, do a beautiful dissection, decompress his nerve, and you should take a look here.
I'm Dr. Lee, and we're in the preoperative holding area. I'm here with Father Corrigan, and he has an intense pain disorder that I'm about to treat today with surgery. And he's one of my bravest patients. He just came to the office and said, after I said that he's a candidate for surgery, he said, I am ready. Let's hear it from his own words.
My name is Greg Corrigan. I'm a Roman Catholic priest of the Diocese of Wilmington. I've suffered with this trigeminal neuralgia. I originally had an experience of the pain of this disorder about 10 years ago. I was driving down to Rehoboth Beach and I got zapped like an electric shock. It's along the lines of when the disc is drilling a cavity and hits the nerve. It was ungodly. It was just a pain like I'd never experienced. I pulled off the road, called my sister, who's a nurse practitioner. I also called my dentist, who later met with me at her office that night. She sent me to my GP. He sent me to an ear, nose, and throat doctor, and I've been very lucky. They put me on Tegretol at the time, and I've had occasional bouts of this pain. They come for like 2-week periods, and I take the meds, and I do better. But for whatever reason, in January of this year, 2024, this thing came back with a vengeance, and I've experienced it every day since. And I've had excruciating pain when it comes. I've been really blessed that I know doctors at Penn. I had been seeing a pain management doctor, Dr. Rita Chaudhry, who's tremendous, and I happened to see her. She put me on steroids initially, added a new med, oxcarbazepine, also put me on Lyrica, and but I've still suffered with this. She connected me with another pain management doctor at Penn, Justin Rowe, who is a tremendous doctor. About a month ago, he did a nerve block for this, and it helped a little, but it didn't help enough. Along the way, I've heard the name John Lee, and I investigated. I asked Dr. Rita Chaudhry if she could connect me with Dr. Lee, and I've been reading a lot and watching YouTubes. And when I met Dr. Lee the first day I met with him, he looked at my brain MRI and he showed me where the trigeminal neuralgia is, and he said, "You are a candidate for the most severe or more serious surgery, which is microvascular decompression. Would you be okay with that?" And I said, "Yes, let's do it." He said, "When do you think you'd be ready for it?" I said, "Today." He left the office, came back and said, "How about next Tuesday?" And here we are. So hopefully today's the day, and I'm going to come out of this a new person. Every trauma, every difficulty that we experience in life, I believe, is our teacher. And when I suffer in some way, I ask, what am I supposed to learn? What is this teaching? I'll be honest, I have never experienced pain like trigeminal neuralgia. It's beyond imagining. And yet, even with this terrible experience, I've learned that there are amazing people that are there that can help. I was connected with Penn Hospital, and I have nothing but amazing, wonderful things to say about the people here. Everyone has been a healer. I believe that our stories are sacred. Every person has a story, and our relationships help us to know the sacred story of another if we just take the time.
So with the endoscope, you'll get to see what I see. This opening is only 1.2 centimeters wide, less than half an inch. Gently going to retract on the cerebellum. By using the endoscope, I'm able to get incredible views with tiny openings. That's the benefit of laparoscopy, endoscopy. And now I'm gently retracting on the cerebellum. You can see the beautiful anatomy. This is the bone, the sigmoid sinus. Now you can see the gorgeous arachnoid. Arachnoid is silk, fine spider webs that suspend the soft brain to the skull. And I just need to open the arachnoid up, and you can see the fifth nerve in all its glory. To the right, you see the eighth nerve. I don't open the arachnoid over that because I don't want to risk hearing loss. Use this scissor, open the arachnoid so that I can tease open the space for the supracerebellar artery and the nerve. You can see that artery in the red just under my suction. I just moved it back. I can move it aside, and what I want to do is fit this Teflon. The Teflon sponge is coming in, and I'm gently laying this in between the artery and the nerve. It's almost like putting a fluffy, beautiful pillow in between your head and your shoulder while you're lying on your side. And you can see that going in right here. And I'm just gently teasing that into place. I keep the arachnoid intact cephalad so that it won't migrate. Some people ask, well, will the Teflon move? But you can see here how it would not move. So now you can see the second piece of Teflon going in, and that's going to provide security that the artery is not going to come back into contact with the trigeminal nerve. To the left, you also see the petrosal vein. I do my best not to disrupt that. If God gave it to you, I try to prefer that it remains intact. And now I'm going to inspect. Make sure. So now I'm bringing the endoscope down free-handed, and I'm going to visualize. Let's look below the trigeminal nerve, see if there's anything else. You can see the sixth nerve, you can see the pons. There's no other vessels. I'm going to inspect the root entry zone. I'm going to look cephalad. I'm going to look up distally towards Meckel's cave, make sure there's nothing compressing there. I took a picture with the Storz endoscope, and it's a beautiful, beautiful view. All right, Dr. Lee, I'm here with Father Corrigan again, and he's now several weeks out from his trigeminal neuralgia microvascular decompression surgery, and maybe he'll tell in his own words how he feels.
I feel great. I cannot believe the pain, it's gone. It's absolutely completely gone, and I am a very grateful person. The recovery was seamless in terms of There was nothing that interfered with my movement, my being able to eat, and here I am today walking the streets of Philadelphia and feeling great. In truth, I think part of what I needed to recover from was previous to the surgery, because the pain was so intense and so day to day, I was on a whole lot of medication. All the gabapentin, the oxcarbazepine, Lyrica. I was really drugged, and the drugs helped, no doubt about it. I would not have made it, but they just whacked me out. They knocked me out. And so I think that being in bed and laying around for so long is part of what my body was learning to adjust out of and return from after the surgery. The surgery was successful immediately. I felt the pain was gone immediately, but I was still groggy. My body needed to start waking up. I got off the meds, the oxcarbazepine, the Lyrica, relatively quickly. I wanted them out of my system. I knew what they continue to do side effect wise, so getting that out of my system was a real turning point as well.
That's great. That's what this surgery is actually really good at, is getting people off drugs. All right. Well, I look forward to many decades of pain relief.
Doctor, you're the best. Thank you so much.
All right, very good. Let's take one picture.